I, Dr. Roma Johri, glaucoma consultant at Shankara Nethralaya, Hyderabad, welcomes you all on the occasion of World Glaucoma Week to spread awareness about glaucoma. This program is mainly for public awareness to know more about glaucoma. What is glaucoma? Glaucoma is a chronic disease that damages the optic nerve and it eventually leads to blindness. The major problem with glaucoma, it is an irreversible blindness. That is, whatever damage happened cannot be brought back by any means. So how common is glaucoma? Glaucoma is the second most common cause of irreversible blindness. And if you have to look worldwide, right now 76 million people are suffering from glaucoma, and this number is expected to increase by 112 million by 2040. In India, 11 million people are suffering from glaucoma, and out of that 1.1 million people are already blind. 90% of them are unaware that they have glaucoma. If you have to put it in a simple word, every 8th. So what is the mechanism for glaucoma, or what are the types of glaucoma? In our eye, if we have to look, there is a fluid. This fluid gives nourishment to the eye. Once this fluid increases because of excess production, it leads to increased eye pressure, and which causes damage to the optic nerve behind. And this causes glaucoma. The other mechanism for angle closure glaucoma is when the drainage pipes around the junction of the black and white portion of the eye get narrowed or blocked. The water is not able to drain properly, and again it leads to the excess water inside the eye, leading to increased eye pressure and glaucoma. So what are the symptoms of glaucoma? Glaucoma in early stages is asymptomatic. Okay, that is why it is also called as silent thief of vision. That is because it affects the side vision or the peripheral vision first. If we have to understand what is peripheral vision, I'll just tell you to do one small exercise. Put your left hand in front of your left eye and put your right hand like this, because tunnel, and put it in front of your right eye. So you can see the person is standing in front of you, but you cannot see the objects or the person is standing side to you. That comes under the side vision or peripheral vision. So that is the one which is affected first in glaucoma, and later on the side vision started decreasing, ultimately leading to tunnel vision, which also wipes off with the end stage glaucoma. Because other symptoms of glaucoma, in angle closure glaucoma, it can be redness or headache, throbbing headache or pain. It can be colored halos, like the colored circles around a light object, vomiting. All these are the symptoms of angle closure glaucoma or advanced stages of glaucoma when your eye pressure is very high. Who are at risk for glaucoma? Glaucoma can happen at any age. A newborn can be born with glaucoma, and that is what we call it as pediatric glaucoma. More commonly, people who are above the age of 40 years are affected with glaucoma, and this risk increases as the age advances. Those people who have a family history of glaucoma, they are 10 times more prone to have glaucoma. Prolonged use of steroid in any form, either in the form of tablet, in the form of lotion, ointment, inhaler, that can lead to increased eye pressure and ultimately glaucoma. So make sure you tell the history of any use of steroid or any other medicines, especially the medicines used for sleep disorder, for stress, for anxiety. These are also adding to the risk of glaucoma. Systemic diseases like diabetes, hypertension, heart diseases and others can also add to the risk of glaucoma. Those patients who are wearing minus number glasses, that is myopia or short-sightedness, are more prone to have glaucoma. Those people who have got injury in the eye are more prone, and thin corneas, they are more prone to have glaucoma. How to diagnose glaucoma? Glaucoma can be diagnosed with the help of multiple tests. One is the checking of intraocular pressure or the eye pressure with the help of applanation tonometry, which is gold standard. Second is to check for the drainage pipes with the help of gonioscopy. Third is to know about your sight vision, how much of the damage has happened to your sight vision. So the test for that is field of vision or perimetry test. Other to check the structural damage of the optic nerve behind is OCT, and to check your thickness of cornea is pachymetry. The other optional tests are disc photograph, stereo photographs, which you can keep it for your record and also for further follow-up. So how to follow up with the glaucoma patients? Generally patients have how should we follow up and how to know we have glaucoma. To give a simple example, when we go for a routine blood test and our random blood sugar comes out to be abnormal, maybe around 160, that doesn't mean we have diabetes. So the doctor will tell you to get a fasting blood sugar level as well as the post-lunch blood sugar done. If that comes out to be abnormal, then they will start you on medication and label you as diabetic. And then again the next follow-up will be depending on your next sugar level. After 3 months, 6 months, they may ask you to repeat the test again. Depending on that, they may modify your diabetic treatment with insulin or with the tablets. Similarly with glaucoma. Once you come for the routine eye examination, we may find that you have a high eye pressure or your optic nerve, the nerve of vision, is looking little suspicious for glaucoma. We may advise you further glaucoma tests that you are falling in the category of glaucoma suspicious. So please go ahead and get the test done. If your tests are normal, we may just regularly follow you up. If your tests are abnormal, we may start you on one medication, tell you to come back again for your eye pressure, and then depending on that we will taper the medicines and we may add more medicines if the pressure is uncontrolled or the damage is uncontrolled. So this is how the glaucoma patients are followed up. So when glaucoma is so common, why it is commonly missed? Because 90% of the patients are unaware when they are diagnosed of glaucoma. Second thing is, once the patient come to the clinic and we tell them that you can have glaucoma, you are falling under the glaucoma suspect category, they say, doctor, we are able to see the last line clearly. We have just come for routine changes of our glasses. That's because glaucoma does not affect your central vision, and that central vision is the one which you are seeing through the glasses and checking in the chart, which remain intact till end. Third thing is, which is hampering the diagnosis of glaucoma, or which is like why it is commonly missed, is the cost as well as the time taken for all the investigation as well as for treatment. Glaucoma is an expensive disease. There are multiple investigation, multiple tests, multiple follow-ups and multiple drops which are required for their treatment. Other factors are that when we tell the patient that you have glaucoma, patient thinks that I have never heard of it, nobody has told me before, maybe I'll go for a second opinion, maybe I'll come second visit and then I'll take the treatment. But sometimes that second visit or second opinion does not happen because patient forgets and then they just delay it. By the time they come back, the damage has already occurred a lot, and then it's an irreversible thing to get back the damage. So these are the factors which are contributing to make glaucoma such a major blinding disease. You should take a regular healthy diet, regular exercise, and you should make sure that you have a comprehensive eye examination with the ophthalmologist at least yearly once to know whether you have glaucoma or you don't have glaucoma or any other eye related problem. Don'ts in glaucoma are, you should avoid drinking lot of water in the morning. Some people have this habit of drinking 2 to 4 liters of water in the morning, thinking that it will detoxify them. So with that, the chances of increasing eye pressure is more. You can have water, but you should take breaks and have it. Don't have it at a stretch. Second thing to avoid is in yoga, the Shirshasana and other exercises which put your head below your heart level. That also has proven to increase your eye pressure and leading to glaucoma. And obviously avoid smoking, that is the other thing. As I have already told you, the comprehensive examination is a must. Glaucoma tests are difficult to do. So understand, especially perimetry, which patient has to do to get a reliable result. Understand the test properly before going for the test, and make sure that you are enough fresh or you have lot of good concentration, fresh mood before going for the test, because it's a tedious thing and it needs lot of concentration. It's a hardly 10 to 15 minutes program or 10 to 15 minutes test, but you have to be fully awake in that test to get a good reliable result. Otherwise we may ask you to repeat the test again. If you are not able to do it test at once, then you can take a break. You can go for a coffee break or tea break and then go for the test again. Third thing to remember is that don't stop your medication. Glaucoma medications are lifelong. So sometimes doctor may write, take the medication for 1 month and review after 1 month. So people generally don't come after 1 month, but they stop the medication after 1 month. That doesn't mean, that means that you have to take the medication lifelong until you are having a next visit with the doctor. Until your doctor tells you to stop the medication, please don't stop your medication. And sometimes, especially because of the COVID or pandemic, patients are not able to avail the medicines. So call the hospital, call the doctors that we are not able to avail this medication. Where can we help you out? Lot of pharma companies are putting efforts to give the medicines, to distribute the medicines in the peripheral areas where patients are not able to avail it. And even for the poor patient, because this is a disease where more elderly and more poor populations are affected, they are even making effort to give some discounts and other things so that you can continue your medicines lifelong and financial thing does not hamper the treatment of the disease. How to use the medication? So use the medication properly. Don't touch the tip of the medication. Whenever you have put the medicines in the eye, close the eyes for 2 minutes after putting the medicine, or put your finger near the inner part of the eye for 2 minutes. Whatever excess drop is there, you should wipe it with a tissue paper, because most of these drops will have preservatives or other content which can lead to pigmentation on the cheeks or which can lead to dryness of skin. So make sure that you have wiped the excess drop, and keep a gap of at least 10 minutes in between 2 drops. So make sure you put the medicines at the same time every day. If you have put the drops at 9 o'clock today, next day also make sure you put the drop at 9 o'clock. Half an hour this side, that side is okay, but try to maintain a regular timings of your drops. And if the drop is twice a day, this means you have to keep a gap of 12 hours, like morning 8 and night 8 o'clock. Don't put it in the morning or 10 o'clock and the evening 6 o'clock. So that thing you have to keep it in mind. Unlike other drops, glaucoma drops, timings, duration and all these things are very important. Make sure you put only 1 drop, because that 1 drop is sufficient to control the pressure. Even if you put excess drop, that will just wash away. So each drop counts. Another thing which I want to make sure is, and I tell to all my patients is, make use of this advanced technology. Okay, put a reminder in your phone for the drops that you have to put, the timings of the drop, as well as for your next follow-up. Second thing is, take a picture of all your documents, whichever test you have got it done, because you should also have the record of all your documents. The hard copy may go or you may not carry them every time, but if you have it in your mail account, you can use it anytime, and if you will get transferred or if you go to some other doctor by any chance, you will know what all has been done, how much was your pressure, why this drop has been started. So the other doctor will know all the details, what was the pressure that time, what was the optic nerve, what was the field that time. So make sure you have clicked all the photos and has saved it properly in your mail account. You should have it forever for your record as well as for follow-up purpose. In our hospital at Shankara Nethralaya, we maintain a software. We have a separate glaucoma package. In that all the 5 tests are included, including your gonioscopy and perimetry, tachymetry, OCT and your disc photo. All this you will get it in the printed form, and it is also saved in the software, which you can retrieve it later if by chance you have missed it or misplaced it. So please join hands and spread the word about the glaucoma awareness. Save the site because the world is bright. Thank you.